morning, good afternoon, good evening po sa lahat. Welcome to our 167th episode of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you po for being part of our credible online community. Saan mong pampanig na kayo naroon at lahat po for the very first time ay ngayon pa lang po makakanood. Welcome po at sana po marami po kayo matutunan at masiyahan po kayo sa topic na pag-uusapan natin sa araw na ito. The University of the Philippines Health Service has been a beacon of healthcare excellence waiting to be explored. It boasts a comprehensive array of healthcare services from primary care, specialized clinics, mental health support, preventive care. This institution offers a vast spectrum of healthcare solutions. Yung pong mga serbisyo na ma-avail po sa UPHS, kung tawagin, these are not just for the academic elite. These services provided are accessible to a wide range of individuals, estudyante, faculty, staff, yung pong nando sa karatig po na community, all welcome po. And the goal is to ensure healthcare excellence permeating in the entire community. So sa webinar po natin today, pag-uusapan po natin paano po ma-avail yung mga ganun po mga serbisyo, how they can be leveraged para po sa mas marami pong makakapag-access. At pag-uusapan din po natin paano po ini-integrate ng team na nasa UPHS, yung pong pagtuturo, research, healthcare services, not just focusing on providing healthcare, but providing healthcare with a foundation in cutting-edge research and also being able to train po kung sino po yung gustong matutunan with regards po in the healthcare sphere. I'm Dr. Raymond Francis Sarmiento, Director of National Telehealth Center, National Institute of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday po, no? Mahaba na rin po ang ating tinakak. It's been almost 4 years now. Very, very grateful to be part of this community. And for this week, very, very special po. Because my co-host will be, you all know her, she is the PGH coordinator for training, Dr. Marie Dion Sakdalam. Dr. Dion.
Good afternoon, Doc Raymond. Magandang tanghali po sa inyong lahat. Of course, I'm happy to be back again. It's been a while, but I've been watching on the sidelines in the past episodes. Magandang tanghali sa lahat po ng aming regular na nanonood in the live broadcast of Zoom. All those watching live via live streaming on the TVUP YouTube channel, as well as on the UP System Facebook page, TVUP Facebook page, and Stop COVID Deaths Facebook page. And of course, to all those watching from TVUP Signal TV Channel 101. I'm really excited, Dr. Raymond, about this topic because not to be obvious about my age, but I was in the UP Diliman Infirmary for I think 30 years ago. And of course, I would like to know the updates on how of the changes in the UP Diliman, the services that they are now providing in the community. And we are very grateful to have our very respectable presenters for this afternoon's webinar. We have the director of the UP Health Service, Dr. Mayrisa Medinda Alip, who will talk about the UP Diliman Health Service and how they would be able to refer patients from Diliman, and even how they manage patients in Diliman, and if ever there is a need to refer to other facilities, their process in doing so. We also have the Vice Chancellor for Community Affairs, Vice Chancellor Professor Roel Hamon from the UP Diliman, and he's here to react on the presentation of Dr. Alip. So very interesting, I think, discussion this afternoon. So hopefully everyone will stay on for this next 1.5 hours. Dr. Raymond.
Thank you so much, Dr. Dion. Very, very important po, no, that we have, but before we really gather what we know about the topic at hand, and something that I've been personally been very, very curious. I haven't really been to UPHS po, no? But it's something na parang ano siya, it's a mythical place for me at the very least. But I've heard so many good things about it, and something that I really looking forward. And everyone, as you all know, as you have seen in our opening billboard, we have transitioned po to broader discussions on how the pandemic has affected health outcomes. So hindi na po tayo very concentrated on COVID itself. Although we have maintained yung pong titulo po natin, Stop COVID Deaths, we have expanded our discussions. And because we all know that you like to always be kept abreast of the latest news in health and medicine here and abroad, we have a segment called the News Updates. Okay, thank you so much. I'll go first with my very first news update po, no? For our first news update, this comes in from the World Health Organization. The World Health Organization has launched the WHO Eyes app on World Sight Day. So vision loss can affect people of all ages. We all know that. And globally, at least 2.2 billion people, 2.2 billion po, hindi po million, billion, have near or distance vision impairment, at least 1 billion of these cases could have been prevented or can be easily addressed with spectacles or cataract surgery. Vision impairment poses an enormous global financial burden with an estimated $411 billion lost in the workplace productivity due to poor vision. So every year po on the second Thursday of October, World Sight Day is observed. At sa taong po ito, taong 2023, the World Organization has launched WHO Eyes. It's a free app for the general public to check how well they can see things close up and at a distance and learn how they can protect their eyes po. Ito po, it can help people quickly and easily identify potential vision issues that merit further checking by a qualified professional. And WHO has decided to share the simple eye test and quick tips for eye care on an application as people use their phones daily, nga naman, and many people are unaware that they have a vision problem until it is too late. It's available in all 6 UN languages: Arabic, Chinese, English, French, Russian, and Spanish, and it can be downloaded for free both on the Apple App Store and on the Google Play Store. What about you, Dr. Dion?
Thank you, Dr. Raymond. So on our part, our news is also from the WHO website, and this is regarding the new funding to ensure 370 million children receiving polio vaccination and to boost health innovation in low-income countries. So according to this article, the European Commission, the European Investment Bank, and the Bill and Melinda Gates Foundation have announced a new 1.1 billion euro financing partnership to tackle global health challenges. So the partnership focuses on eradicating polio and making health innovations more accessible, particularly in low-income countries. So the fund will support WHO and UNICEF to try to eliminate polio, provide childhood immunizations, and strengthen healthcare systems. So the fund will be divided into two. 500 million euro will be designated to the Global Polio Eradication Initiative, while the remaining 500 million will boost health innovation, especially in low and middle income countries. So this partnership represents a substantial increase in global health funding, focusing on equitable healthcare access. And this collaboration builds on existing partnerships between the Bill and Melinda Gates Foundation and the European Commission. So that's it for our news updates.
Okay, thank you so much, Dr. Dion. So tuloy-tuloy lang po tayo, no? So for our news updates, we very thankful to the World Health Organization for those two up-to-date po, bagong-bagong balita, and we wanted to share that to all of you. And And obviously everyone is already looking forward to learning more about ito pong tinatawag na UPHS po. Ano po ba itong UPHS? Pero bago po tayo dumako sa usaping iyon, we'll set our discussion into context by watching a short video produced po by TVUP, which we call yung pong person on the street. Ito na pong person on the street na ito, meron po kami mga ini-interview, common folks on the street. Ano po ba yung alam nila on the topic at hand before we even talk about it? So the questions that we pose to our interviewees are as follows. Number 1, nakabisita na ba kayo sa UP Diliman Health Service? Sino-sino sa tingin ninyo ang maaaring magpakonsulta o magpagamot sa UPHS? Ano-ano ang mga serbisyong nakita o natanggap ninyo sa UPHS? Sa tingin ba ninyo ay kailangan pang madagdagan ang mga serbisyong ino-offer sa UPHS? At ano-ano ang mga inaasahan ninyong maidagdag na serbisyo? Please watch this.
Nakapunta na ako sa UP Health Service, sa University Health Service, UP Diliman.
I mean, all UP students are required to go through a screening process before we enter or enroll in the university.
Then kami nagpapacheck ng ng physical namin dito sa UP. Pag hinahanapan kami ng tungkol sa medical namin, inalaw nila kami na diyan magpa-medical.
Sa tingin ko siguro yung mga maaaring magpakonsulta sa UPHS ay yung mga estudyante, unang-una, yung staff, faculty, at saka kung sino mang na mga napadpad sa community ng UP maski anong campus.
Honestly, I personally haven't been to the UPHS out of necessity because I haven't had any accidents that had happened to me while I was an undergraduate student, thankfully. So it's mainly because of the requirement by the university before we enroll.
Marami din silang binibigay na services. Kasi yung stool namin, yung urine, x-ray, meron dyan. Sa eye, sa ngipin, maraming inano sa amin, sine-check up.
Ang annual physical exam, kung saan binigyan ako ng chest exam, lung exam, x-ray, dental, at yung mga basics na required para ma-check up ang aking health every year.
So doon, pwede naman talaga magpa-check kahit sino. Like, wala naman silang pipiliin or tatanggihan na mga magpapatingin. Pero since parte siya ng university, I think ang focus nun ay una estudyante. Tapos yung mga manggagawa ng UP, whether faculty or staff. And I think even alumni yata mayroong privileges.
If I'm not mistaken, I think anyone can visit the UPHS, but of course, since it's inside the campus, it's mainly servicing to the UP community and the ones surrounding it. But if I'm not mistaken, again, I believe that it's not constrained to the UP community.
Marami namang mag-a-avail dyan ng kasi nakakasabay namin doon, mga faculties, empleyado, mga residents dito sa UP. Estudyante, yun, marami. Kami nga, yung mga guards din, pwede naman, mga janitors, pwede.
Sa tingin ko, ang mas kailangan ng UPHS ay siguro i-inform yung community ng UP kung ano pa mga services na meron sa kanila. Swerte ako na hindi ako tao nagkakasakit na madalas, kaya hindi ko masyadong na-avail yung iba. Pero I think mas makakatulong kung maalam ng public kung ano exactly mga services na kaya i-extend ng HS.
Mainly, I believe, larger emergency rooms or more beds rather for the emergency room.
Pwede naman siguro dagdagan pa nila, pero sa ngayon, okay na rin naman kasi hindi naman siya talagang hospital na malaki. Kaya yung pagkakagawa sa kanya, pang university lang talaga. Depende naman sa national government o kasi national office kung i-allow nila na damihan pa. Laging depende sa budget eh. Pagka kulang sa budget, syempre, hindi rin nila pwedeng gawin gusto nilang magawa. It all depends sa mga budget na binibigay.
Ayun, para sa akin lang, mas malaki siguro yung tulong kung alam ng public na kung ano-ano ang mga services na offer ng UPHS maliban sa mga required at sa mga alam nila.
Para sa akin, ang University Health Service, hindi man porket University or UP Health Service, ang pangalan niya ay strictly para lang siya sa mga constituents ng UP. So kahit sino na need ng medical assistance or ma-address yung medical emergencies, pwede tayo magpunta sa UP Health Service. Matutugunan doon yung mga pangangailangan natin. And para may kita rin natin na ang UP ay may ma-offer pala sa atin na ganitong public service. So para sa mga taga-UP Health Service, mabuhay kayo at pagpatuloy niyo ang mabuting gawain.
Okay, thank you so much, TVUP. Always very interesting to know more about it. May dadagdag ba sa iyong kaalaman, Dr. Dion, after hearing that?
Actually, parang hindi masyado ako narinig kung ano yung mga bago. And I'm really excited to hear from our medical director of the health service. Ano nga ba talaga ang updates, no? And also, maybe we can verify or confirm or correct the perceptions of the community within the area in Quezon City or UP community regarding the services that are available, and of course, sino ba yung pwede nga bang magkonsulta dito sa infirmary na ito. Again, we'd like to thank TVUP for putting all these videos together. As usual, it's good to know the pulse of the people who will supposed to be the recipients of the service that we are discussing for this afternoon. Thank you again to TVUP.
Thank you so much, Dr. Dion. So we all know that everyone very excited to go ahead with our topic, but a little bit of housekeeping lang po for those who are asking. Certificate of attendance will be given to those who have watched at least 50% of the webinar duration. We still keep getting questions po na pag na-log out po ba ako tapos nag-log in ako tapos paulit-ulit yung nangyari, back to zero daw po. Hindi. So ang ginagawa po in the server logs, those are really accumulated. So we will know po how long you have spent in terms of attending or watching po our webinar. And for those who are asking po how they could get a hold of us, you can email us at stopcoviddeaths@up.edu.ph. We have already sent out the certificates for all 166 episodes po, no? So if you feel you should have received one but did not, please email us again at stopcoviddeaths@up.edu.ph. For webinar today, we'll be having a standard panel discussion format, and after our speakers have presented, that will be followed by a Q&A session. But before we delve into the webinar, we have a very, very quick lang po na fun quiz segment that will be preempted lang po. Meron lang pong pauna po na cute, that very short intro video for today.
Hello? Hello? Hello?
Kumusta na kayo lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Okay. So again, si Dr. Susie po, she is still on the campaign trail. We miss her, and we hope and we wish her the best dun po sa kanyang kampanya sa WHO Western Pacific Regional Office po. Okay, can we have also on the Zoom yung pong poll po natin, fun quiz poll. For those who are watching outside of the Zoom, whether in the TVUP Facebook page, StopCovidDeaths Facebook page, YouTube channel ng TVUP, you can still participate in our fun quiz segment by opening up your browsers and typing in slido.com, and when you are prompted, enter the code 6510096. That's 6510096 for you to be able to participate in our fun quiz segment. Meron po tayong dalawang katanungan for today's fun quiz. Question number 1. What types of patients can seek consult sa UPHS po? Is it A, UP faculty and their dependents only? Totoo po ba yun? Letter B, UP employees and their dependents only. Letter C, UP students only. Letter D, non-UP clients. Or letter E, all of the above. Would like to take this opportunity to greet those who are joining us from the Philippine Academy of Family Physicians in Angeles City in Pampanga, Mindoro Occidental Medical Mission Group in San Jose, Mindoro Occidental, West Visayas State University Medical Center, Iloilo City in Iloilo, Capiz Emmanuel Hospital in Rojas City in Capiz, Ateneo de Zamboanga University, Zamboanga City in Zamboanga del Sur, Soc Sargent General Hospital in Surala, South Cotabato po. Meron din po mga pahabol na nanonood doon po sila. Greetings from Tacloban City. Those who are joining us internationally, I'll greet them later po. But from the province of Rizal, the province of Bataan, from Cavite.
Cavite. Yeah.
Yes, thank you so much. From, I think there's Lupi Los Baños, University of Rizal System Health Services Unit. Maraming salamat po yung mga regular po natin, especially from Deca Homes, Loma de Gato, Marilao, Bulacan. Maraming salamat po. We also have those who are joining us from University of Santo Tomas po, and from the Philippine General Hospital. Question number 2 reads, how does one apply as a referral consultant or to have clinic privileges at UPHS? Do you need to send a letter of intent to UPHS? B, submit a CV. C, schedule an interview. Or D, lahat po ng nabanggit. Meron po dito na shout out those from the University of Al in Kingdom of Saudi Arabia, watching from Florida in the United States, from San Francisco, California in the United States as well. Hello, Nasser Drareni from Algeria. Our regulars from the Chonin Hospital in Taipei City in Taiwan, Lunichi Ali University of Blida 2 in Blida, Algeria, Los Angeles in California in the United States, Canadian Medical Center in Dammam, Saudi Arabia. Okay, so encourage everyone po, no? It's really an exercise that you will remember if you participate po, no? And you'll be able to remember yung correct answers po later as towards the end po, sasabihin po ng ating speakers po kung ano po ang tamang kasagutan. Their speakers will comment on the answers later on during the panel discussion. And obviously, everyone's very excited. So I won't keep you. Dr. Dion Sacdalo will introduce po our main presenter.
Yes, thank you, Dr. Raymond. So everyone's excited as mentioned by Doc Raymond, and we see your answers in the Slido. Marami na pong nakasagot. And as we proceed to the webinar proper, please allow me to introduce our presenter. She is the director of the UP Health Service, University of the Philippines, Diliman. Please help me welcome Dr. Mayrisa Melinda L. Alit. Good afternoon, ma'am.
Good afternoon, Ma'am Dion. No? I'm very excited to present the lecture for today para masagot lahat ng mga sinabi kanina. So let me start with this. Let me share my slide.
Go ahead po.
Okay. The UP Health Service, University Health Service at the present. This is the outline of my slide presentation. This is the then UP Health Service. It has been existent for 94 years. And this is the present UP Health Service. The renovation started in 2019 prior to pandemic. This is the facade. As you can see, this structure here is new. No, this is the second floor or mezzanine. We retained the iconic red brick of the University Health Service. Sorry. The UP Health Service is the 25-bed capacity primary hospital. It caters to UP Diliman and adjacent communities, but the priority in the list of the recipient of services are the students, the faculty, the employees, the employee dependents, and the faculty dependent. This is the vision of the University Health Service, a university healthcare facility that will be the center of excellence for the delivery of quality and comprehensive primary care for the students, the faculty, the employees and their dependents, and the university community as a whole. Through its mission, guided by the moral and ethical values, we commit ourselves to provide excellent and comprehensive healthcare through the services of competent staff, a responsive emergency room and ambulance service, an outpatient service with multi-specialty clinic, a primary care inpatient service, a well-designed public health care program to suit the needs of the community, and upgraded diagnostic and ancillary services in the management of health and disease. With the following values: excellence, responsiveness, commitment, and ethical values of integrity, honesty, accountability. These are the objectives: to provide the health requirements needed by the university, to provide the UP Diliman community with a primary health care facility supported and patronized by the community and which can serve as a model for other communities, to make available to the UP Diliman an alternative system for acquiring a higher healthcare service at a reduced cost, and to develop a community model of a healthcare delivery system by the community and for the community. We have the following services. We have the emergency room, the outpatient clinic, the inpatient, the public health section, the dental services, ambulatory surgery, ancillary services, and nutrition clinic. The outpatient clinics, this is the new structure, no? It is fully completed, and we started using it in 2022. It is open Monday to Friday, 8 to 5 a.m., no noon break, and we give free consultation for mandated clients, the ones I mentioned a while ago. The daily consultations for mandated clients, as well as for the residents of adjacent communities. We do pre-enrollment health assessment for students, also pre-employment assessment for employees and their dependents, periodic examination for all UPIS students, and annual physical examinations for those who request for it. This is the new wing, as was seen a while ago. We have about 10 outpatient clinics. Yan, mas detailed, no? This was the old specialty clinics. This is the emergency room, which is open 24 hours a day. This is the inside of the emergency room. We have at least 5 beds. Maluwag na yan, no? We have a treatment room for emergency cases, for trauma, and we do suturing of lacerations as long as minor lang siya. This is the emergency room. A closer look of the emergency room. This is the inpatient wards. It's being constructed. Hopefully, matatapos siya by 2024. We have a 25-bed capacity. We are PhilHealth and DOH accredited, no? So we still need funding for this 2 floors na inpatient for our inpatient and also for the administrative building. If we admit patients who are student and mandated, free and professional fee for those who are being seen by our doctors. And it is also being supported by PhilHealth and DOH, kaya very minor ang mga fees babayaran, no? So, yan, closer look of the construction. The one on the right is your 2-floor inpatient, and also we have operating room dyan. So we also have ambulatory surgery. So this is the operating room. We do minor surgery, excision of excision of lumps, yung maliliit lang. We also do proctosigmoidoscopy and circumcision, lahat po ng minor surgery. And we do it for anybody na may request. And also for mandated clients, meron siyang discount. This is our operating room. It is open Monday and Thursday kasi For now, we have 2 surgeons, no? Discounted fees for mandated clients. Yan, yung closer look of our operating room. We have at least 2 operating rooms in the outpatient. We have our dental clinic. It's open 8 to 5 p.m. This is our receiving area of the dental clinic. Closer look of the dental clinic. We have at least 5 new dental chairs. This is the public health unit section. They provide health education to UP community, environmental sanitation, prevention of communicable diseases, adult immunization, maternal and child health, TB counseling and referral, HIV, etc., etc. This will be the new. The previous slide is the old, it's not the permanent room of the public health section. This is the new home of the public health section. It's located along Apasible. The one, for those who are familiar with UP, it's the one in front of Land Bank and PNB, Philippine National Bank, no? We have several rooms for lectures, for counseling. We also have conference room. We have room for immunization, for breastfeeding. So these are the services of the public health unit. Maraming services because we wanted to strengthen our public health program for health promotion, and prevention. So we have our ancillary services. This is the new radiology area. No? We have X-ray and we have ultrasound with very minimal fees for the mandated clients, as you can see from here. So this is the new radiology area, the X-ray room, and this is our ultrasound room. This is the old laboratory, and this is the new laboratory area. So we give free annual physical examination for those who are less than 35, as you can see here, free yung CBC, urinalysis, fecalysis, and then for those 40 and above, ito naman yung mga free, no? So even if you, the annual physical examination is being given free once a year, but you can have your periodic examination with a very big discount for employees and faculty, 40% discount, and for the employee and faculty dependents, they get 30% discount, and for students, they get 60% discount. And remember that discount will come from the baseline, a very, very, very cheap na fee, no? So malaki pa ring discount even if you pay for your periodic examinations. And the laboratory schedule is from Monday to Saturday, 7 to 3 p.m. Blood chemistry now is being done daily. The 7 to 9 was during the pandemic. These are the available laboratory examinations that can be done at the UP Health Service Laboratory. We consider our laboratory as secondary laboratory. The UHS laboratory participates in external quality assessment program or quality assurance programs of the DOH. It has an acceptable ratings in these assessment programs. Also, we have been given excellent reviews from different screening laboratories. We get excellent ratings in all blood parameters most of the time, and we have been given certificate of proficiency by all testing facilities. Yeah, we passed our microscopy as well. This is our nutrition clinic. We give nutrition counseling for students and all mandated clients for underweight, overweight, obese, and for those needing special diets. We also give lectures, seminar requests from other units. So this is the new nutrition clinic. And our billing and cashier is now fully renovated. This is the new one. There, medical record section. And we also have ambulance services. This is the old ambulance. This is our new ambulance. Organizers of events inside the UP Diliman campus usually request for an ambulance on standby as contingency for possible medical emergencies during events. Now, how do UP Health Service address mental health? We usually give mental health assessment to our incoming students or returning students. We use the Patient Health Questionnaire 9 and the General Anxiety Depression 7. This is the sample of the questionnaire. You give these students upon entry or prior to giving their medical certificate of fit to enroll, because this is a requirement of our OUR before you start your class in UP Diliman. So for the part A, if the answer of the student for these questions, feeling nervous, anxiety, and this, for these 7 questions, if not at all, you give a score of 0. If he feels it several days, you give a score of 1. And if he feels it more than half day, you give a score of 2. And nearly every day, you give a score of 3. And for this part B, same thing. And you total the score of the said PSQA, Personal Health Questionnaire 9. Yeah, this is a closer look, no? There. If the score is 15 and above on A, general anxiety or depression, and the score of 15 and above on PSQA 9, we refer the students to psychiatrists for intervention or management. If the score is 10 and above, we advise to seek UP Diliman mental health services, either the UP Diliman Psychosocial Services, and below, probably this is below, Office of Counseling and Guidance, ugnay ng pahinungod for the said scores. For those with active suicidal tendencies, based on the interview, we refer them immediately to a psychiatrist for medical consult and clearance, to a psychiatrist of choice, or if they prefer to be seen by the UP PGH psychiatrist, then we refer them to PGH. The student is asked to countersign beside the written recommendation of the doctor in the record that he or she confers with the advice. This is the process on how we refer patients to PGH in an urgent case, no? For example, suicidal or suicidal thoughts. The physician on duty, the one on duty at the emergency room, assess the patient needing urgent referral. Now he informs the patient's immediate relative or guardian or the dorm manager of the need for transfer. Then the physician on duty refers patient to PGH, ER officer. He or she has to call the ER officer to tell them that there is a referral from UP Health Service for psychiatric intervention. He also has to call the psychiatry resident on duty and or the toxicologist if the patient has ingested something or overdose, has taken overdose of a drug. Or if the patient or the parent or the guardian prefers, we refer them to hospital of choice. However, there are occasions when there is a problem here and here, especially if the patient does not want to reveal the condition to her or his parents. No, we refer the patient. We inform the patient that we have to call the parents. However, there are a lot of instances wherein the patient does not want to reveal the condition or does not want to inform their parents. That's where the issue lies. Now we just tell the dorm manager or whoever the patient is comfortable to be with or to be informed of the said condition. Now, the issue here, when we call a PGH, the problem is there is difficulty in getting hold of the ER officer. Probably the lines are busy or the ER officer is busy. And we have to endorse to 3 different doctors. We have to call the ER officer first, and then we have to call the psychiatry resident on duty, or anything in particular, the toxicologist on duty, prior to the patient being transported to PGH. Now, for non-urgent cases, the OPD doctor assesses patient needing non-urgent referral for mental health services. The physician gives advice, medical management, and issue referral for mental health services, either to psych-serve, pahinungod, or psychologist, ugnay na pahinungod, and sometimes to the gender office. The problem now here, the students seek clearance from other services. Also, there is sometimes miscommunication wherein the student does not want to wait for a long line in the said services, so they immediately go to the psych serve, even if they just need to be seen by other psychological experts. So there is a very long line to psych serve. Recently, we had launched the Mental Health and Psychosocial Support Network. It's a network of persons, units, and organizations within UP Diliman committed to provide mental health and psychosocial support services for the UP Diliman community of students, teachers, and employees. This has been launched last October 10. This MPHS is for the mental health providers like the UP Health Service, the UP Psych Serve, the Panghinungod. Each is the protocol so that they know what to do when a student or an employee had a psychiatric and psychosocial emergency. They will be able to attend to them properly. So that's all for the services of the UP Health Service. Thank you very much.
Thank you very much, Dr. Mai. Very interesting, and it's really a good update on the current, structural status of the infirmary. And then, of course, we also saw the inside of the hospital. And if I can remember, 30 years ago when I was there, it was kind of gloomy. It was dark. I would remember that because I had to visit a friend who had an emergency. So now looking at your pictures, Dr. I feel like our patients or the community will be, more comfortable going to the UP Health Service in Diliman, and hopefully that will also encourage them to be more proactive in their health-seeking behavior. Another interesting, Doctora, is the your mention, or you have a significant portion in your talk about mental health. So maybe later on we will talk about that in more detail. But thank you very much, Doctora. And I see in our chat that there are already a lot of questions meant for you. So we will also bring that up later during our Q&A. So Doctora, thank you po.
Thank you.
And we'll call you again later. So our next speaker is our Vice Chancellor from UP Diliman. He will try to, of course, give a reaction on Dr. Alip's presentation, but I think he will also talk about the other units of the university, such as the campus maintenance office, police force, and all other units that may be of service to the rest of the UP community. So without further ado, please welcome our Vice Chancellor, Professor Roel Hamon. Good afternoon, sir.
Hello, good afternoon to everyone. First, apologies. I might be code switching from English to Filipino and back. So apologies to our foreign language friends who are watching right now. First things first, Dr. Mai has been very humble and very, I think she failed to mention the what the UP Health Service did in spearheading the COVID vaccination rollout here in Quezon City. The UP Health Service was one of the first, to accept the vaccination for Quezon City residents, and they really did a good job. Yeah. So anyway, kinakabahan ako dahil isip ko rin what am I doing here? In a company of doctors, hindi naman po ako doktor, pero sige, I will try my best to give you a situationer, the context in which the UP Health Service operates. The Office of the Vice Chancellor for Community Affairs handles or under its umbrella, we have 7 offices, which include the University Health Service. We have the Campus Maintenance Office. We also have the Public Safety and Security Office. We have the Transportation Management Office. We also have the Environmental Management Office, the Office for Community Relations, and the Housing Office. These are all UP Diliman officers. In addition to that, we are the lead office in UP Diliman that directly coordinates with the 7 barangays, that yung nasasakupan, ng property ng UP Diliman. UP Diliman has 493 hectares, so we have 7 barangays in our boundaries. So that includes UP Campus, Christian Ligas, Barangay Old Capital Site, Kulyat, Old Balara, Katuna, and Basra. So aside from that, aside from the students, the mandate of the UP Health Service, we have the barangays. So Barangay UP Campus alone has about 53,000 population. So ang average enrollment for UP Diliman per semester is around 27,000. Faculty and staff complement is around 3,000. So we have another 1,500 approximately elementary and high school students at our UP integrated school. So we also have about 1,000 guests or visitors daily, and about another 1.5 auxiliary services that would include janitors, the security guards. So UP Diliman has a very, very unique population profile. So we're saying even though the UP Health Services mandate is to provide quality healthcare services to faculty and staff and students, we also cater to the various types of individuals visiting or residing near or within the campus. So because of this unique position of University Health Service, the University Health Service is able to see patients from the highest ranking government officials to the lowest members of our urban poor communities. So because of that kind of profile for a community health service, our doctors, I assume, are getting the full range of medical issues that are ail our kababayan dito sa UP campus. So I was when I saw yung University Health Service, yung mga pictures ni Doktora, parang nakulangan ako, kaya we prepared a short video para maipakita sa inyo a short parang video tour of what the University Health Service is now. Thank you. Play. So, sabi nga kanina ni Dr. Dion, parang madilim dati, no? So, this after this renovation, although hindi pa siya 100% complete, medyo mas maaliwalas talaga siya, no? Yung health service. Our lobby, very, very inviting, no? So, yeah. So I'd like to point out, no, na the university health service seemed empty nowadays, no? Sabi ko ka, I would rather see the university health service this way kasi it tells us that we have a healthy community, no? A healthy community na hindi kailangan laging puno ang emergency room, no? So a healthy community that is very, very aware and conscious about health and safety. So this is a very good indication. This is a very good reason, no, na the university health service can and may be able to provide better health care, no, mas maraming atensyon sa bawat pasyente na may bibigay, at may panahon at pagkakataon para makagawa ng sarili nilang mga research, no. Kaya sa buong OBCCA family, no, we endeavor to make the health and safety approach holistic in a way, no. So in cooperation with the other offices of under the OBCCA, so we ensure na a lot of the emergency, no, na experience sa campus before the time of pandemic. Ano ba yung itong mga to, no? So normally sa campus we have fraternity-related violence, we have slips and falls, no, and we have some mga matatapilok, mga sports-related injuries, no. So we endeavor to look at it from a very, very holistic perspective, so that if we are able to address this minor accidents, the university health service can proceed with the deeper or the other dimensions of healthcare providence, no? So what are these? No? I'm looking at, no, na yung opportunities na that the UP health service would be able to strengthen campaigns, no, for issues like teenage pregnancy, issues like mental health, issues about vaccination, issues that often are taken for granted by a lot of the members of the community. Dental care, no, isang issue na kayang-kaya ng tutukan ng university health service, not because of the new facility, not because of just the new facilities, but because of yung approach nga natin sa community is now holistic. So we can concentrate, we can focus on the other things, no? So that is what we're doing at the OBCCA. And yeah, I'm very, very glad and very, very confident about the competence and confidence ng mga doctors natin sa University Health Service. So these are the new rooms. I will show these rooms, what these rooms are. So, but yeah, I think you see the picture, no? So yeah, we are doing a lot more pa for providing quality healthcare services. Pero nga, we're just a small primary care facility, no? So if we want to improve our services pa, we actually need the cooperation of the whole community, no? So in terms of a holistic approach, no, to healthcare and the holistic attitude, no, towards taking care of our own body. Okay lang po. Maraming salamat.
Okay, thank you so
Okay.
much. Thank you so much, VC Roel. Maraming salamat po. I think that was the very first time that I've had like a virtual tour of ano po of the space. Thank you so much. Dr. Dion, go ahead.
Yeah, thank you, VC. That's how we call pala Vice Chancellor for short. VC Roel, thank you very much po, sir. Of course, Dr. May showed us some pictures, but I think the video tour gave us a better perspective, and probably it became more, I'm sure the community is more willing now to try to visit the place, maybe consider the infirmary for their medical needs, at least for primary health care. So yeah, it looks like very enticing already. So thank you po. And of course, the other addition that you mentioned about your talk, you mentioned about the service that UP Diliman provided in the vaccination during the COVID pandemic also, which Dr. May was probably shy to boast about, but our VC is here to tell us of what the service provided for the UP community. So thank you very much, VC Roel. We have a lot of questions as we review our chat box, and actually right from the start of the talk of Dr. Ramay, may mga questions na rin sa Q&A. So maybe before we proceed with the panel discussion, we can probably proceed first with our public service announcement today, Dr. Raymond.
That's correct. We'll just take a very quick break po for our public service announcement for today.
O sige na, anak. Parang kagat lang ng langgam. Kantik o yung kumikiliti lang. Ito naman parang hindi ka pa nababakunahan dati. Akala ko pa naman brave girl ka. Nakakahiya na kay Doc.
Okay lang po, nanay. Ay, ang cute naman ng shirt mo. Favorite color ko rin yan.
Doc, favorite ka rin po ang color nito. Pero ayoko po ng red hunting. Masakit kumagat at takot rin po ako sa blood. Magtudugo po ba ako sa bakuna?
Ah, hindi. Walang dugo sa bakuna. Konting pisil lang, tapos na.
Kakasugat ba ako, Doc?
Hindi ka magkakasugat. Lalagyan lang natin ng plaster pagkatapos para safe. Di ba nabakunahan ka na rin ng contra measles at chickenpox dati? Parang ganun lang din ang bakuna para sa COVID-19.
Natatakot pa rin ako, Doc.
Alam mo ang secret sa pagiging brave. Hindi ibig sabihin na wala kang kinatatakutan. Kundi, kahit natatakot ka, hinaharap mo pa rin ito.
Okay. Ready na po ako, Doc.
Una, pupunasan ko muna ng bulak na may alkohol ang braso mo. Okay? Tapos, mabilis lang na konting... Ayos! Tapos!
Tapos na, anak. Pwede mo nang buksan ang mga mata mo.
Nay, sabi sa inyo, brave girl na po ako eh.
O, heto ang prize para sa'yo, ha? Wow! Bagay sa shirt mo. That's the color of bravery.
Color rin yan for love. Thank you, Doc. Thank you, Nay. Dahil ako po ay mahal ninyo, nagpabakuna na ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center. Thank you so much, TVUP, the COVID Communication Public Service Announcement, just one of the many creative outputs of the Stop COVID's team to push for COVID-19 vaccination. So please share this video clip in all of your social media accounts. Stay safe and stay well. Magpasama na po sa Bakuna Center. Okay, please go ahead and start the ball rolling with the questions, Dr. Dion.
Okay, so to our speakers, Dr. Alip and VC Roel. We start with a question here from Mr. Ricardo Di Mayuga. Doctor, I think, and this is directed to Dr. Ramay, in the event of full implementation of the Universal Healthcare Act, will UP Health Service be accredited as a primary health facility? Dr.
Yes, I think so. Yes, because as of now, we are fully accredited as primary healthcare provider ng PhilHealth. In fact, at the moment, we are now working naman on the OPD and Consulta MD. We are just completing the documents to be accredited for Consulta MD there. So definitely yes.
Okay, and when you say Consulta MD, Doctora, this is
OPD
for...
naman yun. For the outpatient clinics naman.
Oh, how about teleconsultations, Doctora? Is that also a service that can be provided?
Luckily, we started our electric medical recording in 2016. We have been the pilot project of PhilHealth for this. And when the COVID started, we were able to shift to teleconsultation. However, lately we shifted back to face-to-face because of lack of human resource. Kasi when you do the teleconsultation, you reserve some for the teleconsultation, wala nang matitira for the OPD and for the one going 24 hours duty. So kulang na siya. So we just wanted them to go face-to-face. In fact, pag teleconsultation ngayon, more of the specialist muna. Kasi yung specialist clinic, hindi pa siya open, no? So, for teleconsultation, we discourage it. We want it face-to-face na lang.
Okay. Thank you, Doctora. Dr. Raymond, do you have any question for any of our speakers?
Okay, so question po that I have here is related naman po in terms of operational efficiency. So they're looking at, so how are patient records, that's why I picked this question how are patient records and data management handled po? Meron daw po bang electronic health record? And are all of the staff essentially competent daw po in terms of using the electronic health record?
Electronic medical recording na kami since 2016.
Okay,
Meron din kaming data privacy officer. Tapos, the physicians who will see the patient will the only one that can get hold of the record kasi merong password.
Okay. Okay. Thank you, ma'am. My next question that I have here would be in terms of credentialing process, accreditation, is that matagal po ba yun bago nakuha ng UPHS? How was the process, etc., ma'am?
Yung sa DOH, tsaka sa...
DOH and PhilHealth, ma'am. Yes po.
Ay, lagi na kami, kasi lagi kaming yearly yan, yearly. So, walang problema. We are DOH accredited, we are PhilHealth accredited since the beginning. Okay.
Dr. Dion?
Yes, there's another question here for Dr. Ramay, and this is from Marilu Reñales. I think she's a doctor too. I think I worked with her during our
Shout out to my classmates.
Hello,
Class of
Dr.
85. Nanonood silang lahat.
Hello, class 85. So Dr. Marilu is one of our volunteers, ma'am, may sa PGH Telegabay when we had to open our teleconsultation services for patients across the country. We even had some patients from abroad, mga Filipino patients na they cannot consult a doctor during the height of the pandemic. So going to the question of Dr. Reñales, he asks whether you offer occupational safety and health services to both employees and the rest of the population covered by the UP Infirmary. So occupational safety and health services po.
Actually, yung mga occupational safety and services, pag we visit the offices, no? So, meron kaming mga occupational health graduates na umalis na, although retired na. Ako rin, meron ako occupational health, no? And we just, actually, we take a look at the offices, we provide it, talagang meron na siyang, kasama na siya sa mga programs, no? Yung occupational safety kasama na. Most especially nung nangyari yung COVID-19, no? Nag-inspect lahat. But we partner with our engineers, mechanical engineers, para nang sa ganon, hindi lang siya more of the medical part, no? So, kasama na yun sa programa ng UP Health Service.
Okay, that's good, Doctora. And thank you for extending the service to the work areas of the UP community. There's another question here, Dr. Raymond. Is that okay? Ako muna.
Sige, go ahead po.
Okay. So, yung another question, Doctora, is you mentioned about public health service, and there's a question on whether you also provide screening for non-communicable diseases, particularly siguro yung cancer. siguro at least for the common ones like breast for females, I know cervical maybe, or even colorectal, Doctora?
Oo. Yung mga kasama sa annual physical examination, yun lang muna ang mga forward namin, yung fecalysis of the blood blood. Yun. We are trying to get hold yung FIT, immunochemistry, pero wala pa. Tapos may program ngayon na yung breast examination, number 1 yan. Pag may mga programs kami, halimbawa, Women's Month, sinasama lahat yan sa program ng public health. Meron din kami screening for mga HIV, mga ganyan. No? Sinasama yan sa program. Pero incorporated doon sa annual physical examination, yung mga the usual, plus yung mga screening na kaya, no? Yung mga pap smear, pero OB ang gumagawa niyan, no? Dito sa amin na meron din naman tayong OB. Meron program ngayon na inaayos pa with the Philippine Genome Center. Meron kasi mga screening for cancer na mga na mga blood yata yon, o meron silang mga ginagawa ang PGC to screen yung mga cancers. So inaayos pa yon, no? Meron pang kailangan pirmahan ng mga documents for that. Pero for the rest, na very common, basta age na 50 and above, yung mga may history of breast cancer, pinapamammogram na yon. In fact, meron na rin kaming request for the mammogram, no? Kasi meron kaming ultrasound, meron kaming female ultrasonographer, meron kaming ultrasound yung request na yung mammogram for the screening ng breast PA, no? So, yung mga fecalis for occult blood, yung mga PSA, lahat yan nire-request sa amin, lahat ng mga blood. Pero send out yung iba pag wala sa atin. But we include that in the annual physical examination. We send it out. Pag willing naman yung patient to pay an extra, so nagagawa namin yun. No? So meron din kami ultrasound for, let's say, prostate. Meron kami lahat yan. So yung kaya ng health service. So ang aming laboratory actually is secondary. At meron silang mga proficiency na natanggap ng mga awards, so okay naman siya.
Okay, that's good to know, Doctora. Thank you very much po. Okay, maybe we can tackle this question of Mr. Joseph Tortona, Sir Doc Raymond, no?
Sige po.
The question is, will the community infirmary also have tools necessary for surgical instruments, or for surgery probably, enough for outpatient minor surgeries, as did the health centers during the time when rural medical practice was compulsory?
That is a very good question. So, in the past, we had our maternity, parang maternity line-in, no? And I used to be head of that maternity line-in. We were able to deliver normal delivery. So, may gamit kami. Meron kaming gamit for birthing. More so, may gamit kami for minor surgery. Kompleto siya. Kasi meron kaming surgeons, no, na mga trained surgeons sila, in fact, na gumagawa ng minor surgery. So, kompleto po kami. No? Ang amin lang, ang tag-OR namin, minor OR, napakaganda. Ang kulang na lang ay, bahala na si Sir Hamon later or maghanap ng mga donor for the new operating table. Yun lang ang medyo, maganda pa ang aming operating table, pero napakaganda ng kwarto, kailangan na sigurong palitan. No? So, yung mga classmates ko na nasa Amerika nakikinig, kailangan namin ng new operating table, pero aming operating room light, maganda. So, wag kang mag-alala, Doc, meron po kaming kompleto for minor surgery. So, we do excision, may pang-procto din tayo. No? So, kompleto po.
Maybe, Doctora, pwede na rin procure for a colonoscopy, so we can also do endoscopies for at least as a screening for colorectal
Kaya
cancer.
nag-invite din ako ng mga consultants na willing to do clinics here. Nandyan si Dr. Ken, no, na nag-apply na for who do colonoscopy rin, di ba? So, nag-invite din tayo. Baka ikaw, Dr. Yon, pwedeng mag-apply later on dito as a parent consultant to do colonoscopy. Di ba? Pwede rin yun.
Thank you, ma'am.
Kasi ang goal ng ating mga officers is pag pumunta, kasi kung malakas ang yung primary care, mababawasan yung pupunta sa secondary, di ba? So, ang gusto ng ating nakaraang presidente, si PDLC noon, ang sabi niyang word, Doktora Ali, pag pumasok sa health service, hindi na dapat yan lalabas pa sa iba pang health facility. Diyan pa lang, magagawa na ng paraan. So, yun nga, kung makaka-procure ng mas magagandang instrumento para makapag-screen ng cancer, mas mabuti kaysa i-refer sila sa labas kasi masyadong mahal.
Opo, thank you po, Doktora. There's another question here, Doc Raymond. This is from Mr. Ricardo Di Mayuga. Well, he mentioned about UP or PGH Diliman. I don't know what is the progress as far as that is concerned, but the question reads, if it becomes a reality, will the UP Health Service be absorbed since the services offered will be duplicated?
Yung una siguro later on sasagutin ni Prof. Hamon kasi meron na talagang yung UP Diliman, meron na siyang venue, yung pera na lang kulang. Pero I don't think i-absorb kasi iba ang goal, iba naman ang parang population nun. I think it's more of a cancer or specialty area na parang doon ang may research for treatment, for high polluting diseases, hindi siya for primary care. And I don't think i-absorb ang health service kasi iba ang role ng health service. Remember tayo ay health promotion, prevention, no? So more of primary tayo. So malamang maganda yon kasi doon kami magre-refer later on kung kinakailangan ng for tertiary intervention, mas malapit kasi sa PGH in terms of chemotherapy. Parang yun ang pagkakadinig ko. Ngayon, kung reality naman, tanungin natin si Sir Hamon kasi alam niya kung nasaan yung UP Diliman.
Okay, VC Roel. Baka
VC Roel, yes, sir.
Yes. Go ahead po.
Yung reality po, matutuloy po yan. Hindi lang po natin alam kung kailan masusunod. Pero matutuloy po yan. At ang balita ko nung nabanggit sa amin ni dating President Benilo Concepcion na ito nga ay magpo-focus o mag-specialize sa cancer. So yung Cancer Institute na nasa PGH ngayon, gusto niyang palakihin at isang hospital dito sa Diliman, isang parang Cancer Institute ng PGH. No? So yun ang magiging focus ng bagong PGH. Kaya hindi siya ma-absorb, hindi siya yung gawain ng health service. Pero matutuloy po yan.
Okay. Thank you, VC Roel, for clarifying that. And we're also excited to hear about what the PGH Diliman can offer to our Quezon City community. Doc Raymond,
I have a question lang.
Sige, ikaw muna.
Dr. Dion,
Go ahead.
for VC Roel. VC Roel, what are the efforts being done by your office daw to make sure that those in the community, not just those within the UP community, but yung sa Cruz Naligas, etc. po, who may not be necessarily taga-UP, they know about these things po. So parang the question kasi that I got was parang they're not aware that there was such multiple na services po that's available. So in the office of the Vice Chancellor for Community Affairs, what's being done, sir, to disseminate?
Alam naman po natin na lahat na marami sa mga kababayan nating Pilipino, lalo na yung mga nasa urban poor community, takot pumunta sa ospital. Dahil ngayon nakakawig na gastusin pag papasok sila ng ospital, no? So sa amin pong pinalalakas po namin pinapakita po namin na yung koordinasyon nga ng iba't ibang opisina kasi nais na namin na mas mabuting ang University Health Service itutok ang kanilang atensyon sa preventive na aspeto ng health service kaysa sa palaging emergency na paggagamot, no? Mas magkakaroon tayo ng mas Kaya ang kampanya namin, magsisimula kami ng kampanya talaga na palakasin yung aspeto na yon, no? So promotional materials, campaign materials, at yung pagbaba ng doctors at nurses ng University Health Service sa mga community mismo. Last Saturday nga, nagkaroon kami ng medical mission sa Puok Malinis. Isa ito doon sa mga depressed areas ng UP Diliman, no? Na na-relocate namin doon na-relocate yung ibang mga informal settlers. ang kasama po namin ay mga volunteer doctors at nurses ng University Health Service mismo. Natutuwa nga sila na yung community, natutuwa sila na ay kung hindi pala kami makapunta sa health service mismo, kami pala yung pupuntahan dito. So ang sabi nga namin, dahil holistic at inclusive yung tingin namin sa bagay na yan, mauulit at talagang gagawin namin programa rin talaga ng University Health Service na pumunta rin sa komunidad kung hindi man sila makapunta ron. No? At syempre, ma-promote na rin yung mga services na inaalok ng University Health Service.
Very nice. Thank you. I think, VC Roel, the mere fact that there was allocation of funds to improve the structure and the services that can be provided by UP Health Service Diliman is already one testament to how much the university values the people, because they think improving the healthcare or the health-seeking behavior of the people would probably provide improvement also in the quality of life of the community. So hopefully we continue to prioritize health as we expand the services and also improve the structure or the facility of the UP Diliman. Thank you po, VC Roel. Do you have anything more?
I think that should be it, Dr. Dion. Thank you po.
Okay, so siguro we can now try to answer our
The two
fun
questions.
quiz. Yeah.
Yes, we'll do the 2 questions in the fun quiz and then we'll ask them about the their final messages to the audience po, no? So can we also have on the screen the okay, there we go, Slido. First question, 2 questions po, no? I'll read the question, Dr. Alip, and then you'll tell the correct answer, ma'am. So first question, what types of patients can seek consult with UPHS?
Actually, lahat. Wala kami tinatanggihan, no? So, ang priority nga, students, employees, faculty dependents, lahat nga eh. Kung titignan mo, Doc Raymond, tsaka Doc Dion, nung ako'y nag-aaral ng MHA, tinignan ko lahat ng nag-o-offer na university or school ng mga benefit for students. Ang UP Health Service, Diliman, ang pinakamaganda, ang benepisyo para sa estudyante. Kasi 50 pesos noon na medical fee, na ngayon wala na, lahat ino-offer. Kasi pag nagpatingin ka sa emergency room, hanggat enrolled ka, libre. Ganun din, pag ikaw ay na-confine, libre ang professional fee. Tapos pagka doon ka sa ward, very minimal. Ganun din ang empleyado, saan ka nakakitang including their dependent kasama, no? So, employee, faculty, and their dependents. Ang estudyante, hanggat enrolled ka. Ang empleyado, hanggat hindi ka nagre-retire, patignan mo nanay mo, tatay mo, anak mo, kasama lahat yon sa dependents, libre ang professional fee, discounted pa ang amount. At sa mga nasa labas naman, yung mga taga-Ayala Heights, Loyola Heights, welcome sila kasi yung ating mga laboratories at services is being subsidized by these, no? Yung meron silang payment, pero alam mo kung tutusin, marami kaming clients from those areas kasi mas mura pa rin kami kaysa mga laboratory within the area ng Diliman. Pinakamura pa rin. So, pag nagpapatingin sila, welcome silang lahat. So, lahat po pwedeng magpatingin sa health service.
All right. So get ready, Doctora, for the upsurge of consultations in your facility in the next
in my
few weeks.
26 years of service, maraming kliyente ang UP Health Service. So nito lang lately kami malungkot kasi nga nakasara ang ward, so hindi kami makapag-confine ng mga ating mandated clients, lalong-lalo na mga estudyante nakatira sa probinsya. Pag nagpa-confine, isolate dito sa UP Health Service, libre ang professional fee. Ngayon, wala kaming paraan para ma-confine sila, maski yung simpleng kaso lamang. So sana maging pasensyoso ang PGH sa pagtanggap sa mga estudyanteng ito. Kasi ito naman ay mga priority rin dapat, no, ng ating PGH kasi we are under the umbrella of PGH. Doon lang nagkakaroon ng problema pagka kinakailangan nilang ma-confine.
Okay. Thank
Okay,
you,
thank you.
Dr. Alip. Question number two reads, how does one apply as a referral consultant or to have clinic privileges at UPHS?
All of the above. Halimbawa, gusto, lalong-lalo na ini-encourage namin ang mga UP graduate, ang UP PGH graduate, na mag-clinic dito, no? So, kinakailangan lang nilang, they just have to send a letter of intent to the UP Health Service Director. Together, they attach their curriculum vitae. Tapos, they will be scheduled for an interview by our panelists. So, madali lang po. Ang kailangan caveat lang sa iba. Kasi pag dito, naging consultant ka, discounted sana yung ating mga mandated clients. Tapos, ang referral sana, dun sa mas murang hospital ninyo na pwede silang confine, bumawi na lang po tayo sa mga mayayaman nating kliyente. Yun lang po.
Okay, thank you so much, Dr. Alip. I'll just read the next poll, which is evaluation poll lang po, and then Dr. Dion will call both of you, si VC Roel muna, and then you po for your final messages po. So what we have here is our panel discussion poll. It's 5 questions, 5 statements, 4-point Likert scale, strongly agree, disagree, strongly disagree. And we encourage everyone to participate given that we are not sending a separate one. Ito na po yun. So hopefully everyone here in the Zoom will be able to participate. So I'll read them as follows. Number 1, the panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Number 3, the panelists spoke clearly and audibly. Number 4, the panelists used appropriate language and technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key health issues. So we will not be closing this until the end of the presentation as we now move on to the parting messages from our speakers. Dr. Dion.
Okay, so as we move to the closing part of our webinar, we ask our speakers, we start with VC Roel for your message for our audience, and then we will follow by the message of Dr. Mayisa. Go ahead, VC Roel.
Maraming salamat po. Maigsi lang to. Siguro sa ako'y isang lahat naman tayo na ngailangan ng health service. Isa ako sa naging needy, lalo na ng panahon ng pandemic, no? Sa mga services ng medical services. Napakalaking tulong ang naibahagi sa akin at sa pamilya ko at sa asawa ko may sakit noon ng University Health Service. Yung mga panahong akala ko desperado na, no? Nandiyan pa rin pala matatapang natin at magigiting natin mga doktor at nurses at mga kawali sa University Health Service na mas nung panahon ng pandemic. Kaya sila. Sabi ko nga parang sa isang health provider or healthcare facility para sa universidad, no? Parehas lang yung ginawa nilang pakikibaka ng panahon ng pandemic. Hindi dahil sa malaking kinikita nila o hindi dahil sa nariyan sila dahil sa totoong pagkalinga at pag-unawa sa pangangailangan ng komunidad. So para sa tanggapan naman ng OBCCA, ina-assure namin na yung services ng University Health Service ay paitingin namin, pagbubutihin palalo at patunayan gumagawa na kami ng hakbang para makakuha ng at least ng ISO 9001 certification ang University Health Service. Kasama yan sa ginagawa namin sa mga nakaraang mga linggo. No? Papunta na kami dun sa pagkuha ng ISO 9001 certification. Maraming salamat po.
Thank you very much, VC Roel. We hear and we feel your passion and dedication to improve the services of UP Infirmary. Now we proceed to the parting message of Dr. Mayisa Alip. Dr.
First of all, gusto ko lang magpasalamat sa ating mga pinuno, no? Dahil sa malaking improvement ng UP Health Service para nga sa community. At para naman sa community, huwag po natin nantayin na tayo magkasakit sana para gamitin natin ang gamitan ng UP Health Service. And lahat ng ito, lahat ng pagtulong namin yung COVID, nakalimutan yung banggitin, sir, pero yung ating mga isolation facility, malaking sakripisyo ng ating staff. Pero nagiging successful lang po ang aming paglilingkod dahil sa aming UP Health Service staff. Kaya po sila, nagpapasalamat tayo sa ating pamumuno kasi sila lahat ay mahusay, very competent at very dedicated. At para sa community, lahat po ng UP Health Service staff, malakas, matikas, magsisilbi hanggang wakas. Yun lamang po.
Thank you, Dr. Alip. Salamat po also to our UP Health Service staff. And we hope you continue the good work and the hard work that you have been doing for the UP community and nearby communities. So, Dr. Raymond?
Okay, thank you so much to the UP Diliman team, especially represented po by Vice Chancellor for Community Affairs, Professor Roel Hamon, and Director for Health Service po, UP Health Service, Dr. Mayrisa Melinda Alip. Maraming salamat po. And hindi po magtatapos diyan dahil marami pa po kaming tatanungin in future webinars po natin. So hopefully you'll be able to participate po in our future webinar. So we're still getting answers for our evaluation poll, but for our synthesis and closing remarks, this will be given by the head of the Office of Expanded Education and Training at the Philippine General Hospital, Dr. Stella Marie Jose. Ma'am Stella.
Good afternoon, everyone. Thank you for watching our TVUP webinar. This has been a very interesting webinar. We have Dr. Mayrisa Alip, who is the Medical Director of the UP Health Service, and she mentioned the services that are the facilities that are now offered for free for all our UP constituents. No? So we have the emergency room, the OPD clinic, the inpatient clinic, public health section, dental clinic, ambulatory surgery, ancillary service, and the nutrition clinic. You know, it's very important that we all know what they have so that our patients, future patients, can go there. And the benefits that are given to all are for 39 years old and below. I want to emphasize that we have the free annual PE, which is done once a year, and we have free CBC, urinalysis, and fecalysis tests. Now, for 40 years old and above, and those who are retired, there's also a free once a year annual PE, but they have more laboratory tests which are given for free. No, CBC, FBS, uric acid, total cholesterol, and routine urinalysis. They can also have routine fecalysis and fecal occult blood. You know, people don't realize yung fecal occult blood ho kasi it is one of the methods to detect colon cancer. So parang ganun-ganun lang yun. Pero you know, these are all available, and when it's diagnosed early, colon cancer is really treatable. No? Patients recover from it. Now, ang magandang aspect ng kanyang presentation, if you ask me, is the mental health screening. Now, you hear in other schools that students commit suicide and jump sa mga buildings and all that. Awa ng Diyos, hindi yan nangyayari sa atin because we have the mental health screening. So their doctors are trained to screen if a student has mental health issues. So those with active suicidal tendencies are referred immediately to a psychiatrist for medical consultation. And they have a pathway for urgent referrals to PGH and the non-urgent referrals. You know, that's really important kasi sometimes people are confused where to go. Ito, malinaw na malinaw ang track that they have to go to. And for Vice Chancellor Roel Hamon, thank you very much, sir, for gracing our TDUP webinar. We know you're very busy. And if you look at this work description, sobrang haba po. Hanggang sa police at saka traffic kanya yun. So he showed a very nice video of the UP Health Service, and we really appreciate your contribution and your presence and your efforts for the UP Health Service. He said that as a community, we have to have a cooperative atmosphere and a holistic approach to health care. Now, I would also like to emphasize that since UP Manila is our health sciences center, we can also send our students to rotate. We have pharmacy, nursing, PP, OT, and other, and of course, medicine and dentistry who can go on rotation to the UP Health Service. Maybe this can be explored later on. I would also like to give an advertisement. We have a webinar from the Philippine Infectious Disease Society in OBGYN, and it is updates and discussion on OBGYN infections. And I will also do the closing remarks there. Please, if you have time, can you log in and watch our webinar? Thank you very much. Back to you, Dion and Raymond.
Thank you, Dr. Jose, as always. Thank you for a very concise highlight of the presentations of Dr. Alip and VC Roel. Thank you again, Dr. Jose.
What do we have for next week, Dr. Dion?
You have to answer that, Dr. Raymond.
So for next week naman po, but before we mention that, you can still watch us on the playback at the TVUP YouTube channel or at the TVUP Signal TV channel 101 po natin. So hopefully I'll try to watch, especially yung sa video po, no, may virtual tour of UPHS and at the TVUP YouTube channel po natin. But for next week, we'll still keeping with the theme na po, no, within UP, but not really within the traditional sa UP po, no, we will be talking about PGH Clark. Yes, magkakaroon po ng Philippine General Hospital sa may Clark po, and we hope to be able to learn more about kung ano na po yung pinagdaanan nito at saan na po siya talaga, when do we expect this to come to fruition. You are now seeing on the screen po, no, the results of our panel discussion poll, and based on the results po, you will see dito po at least at least 88% of all of our participants indicated po that they strongly agree with the statements po. Just a testament po of those of our topic at hand, as well as the speakers that we have had. So maraming salamat po again to Dr. Mayrisa Alip and Vice Chancellor Roel Hamon for sharing your insights po about the UP Health Service. Before we conclude our program, all Stop COVID Deaths webinars are archived for viewing at the TVUP YouTube channel. So either you open your app po, yung YouTube channel po, yung YouTube app po natin, or you can go to open up your browser, enter po www.youtube.com/TVUPPH for you to be able to see all 166 webinars po, and after today magiging 167 na po siya. We also understand everybody very busy, so we have selected po short consumable videos that we call SCD shorts at your convenience. So hopefully you'll be able to gain kahit very quickly po nuggets of wisdom dito po sa ating mga SCD shorts videos. Okay? So this formally closes po our webinar for the week. Magkita-kita po tayo again next Friday from 12 noon to 2 p.m. It's a date.
Together, we can stop COVID deaths.
Thank you. Bye-bye.
You'll have to say the next line, Dr. Dion.
Yes,
So keep
together
safe,
we can
keep
stop
healthy,
COVID
and
deaths.
see you online.